There are some other countries in the world, I think Denmark, that don't have a universal newborn hepatitis B shot. I think they instead vaccinate based on either test results or risk factors. I'm not exactly sure. Is that true? If that is true, what is different about hepatitis B or the healthcare systems in those countries versus the United States, such that we can't just copy them or vice versa?
Yeah.
Should they also be doing it universally, or are there fundamental differences?
No, actually, and this is an important point because this comes up often and saying, well, why can't we be like Denmark, where in fact they do base it on a risk assessment? But there they have virtually no one falls through the cracks. They have accurate and timely information on the status of the mother for the infection. And again, we keep coming back to this issue because of the number of women that fall through the cracks who are infected, who do transmit to their baby. And that's what happened again up until 1991. We got closer and closer to this routine recommendation for vaccination, but never quite got there. And as a result, we saw this increased number of kids every year in this country. That same approach in a country like Denmark that has an outstanding countrywide healthcare system where they have records on everyone. It's all linked. I mean, in fact, if anything, if you may recall during the COVID experience, where do we get some of our very best data on vaccine effectiveness? Was from countries like that had the kind of infrastructure that could tell you on a drop of a dime what's the status of all these different people are. So, I would love to see us get there, because if we could get to that same kind of healthcare system, think of all the other healthcare problems we'd be dealing with. But we're not there. And so my job is to basically say, so then what can we do to still affect these cases of hepatitis B? And that's what we're trying to do here.
And do you have a sense for how many people total are carrying hepatitis B?
That number varies. I don't have the exact number off the top of my head, but it's surely dropping precipitously as we see a whole generation avoiding it. And that's what's happened with this, eliminating over 6 million infections since 1991. Think of, in fact, all those people had been infected. 91 to 2025, 26 means that by that time, these would be the cases of hepatocellular carcinoma and cirrhosis that we're seeing right now. Those numbers have really dropped because of this kind of activity.